Hi, everybody. I want to talk to you a little bit about revision rhinoplasties. So, revision rhinoplasty is considered one of the most challenging procedures we perform, just because a primary rhinoplasty, which is the nose job on the first time, is already by itself considered by many of us the most challenging surgery, just because of the nuances involved, how millimeters make huge differences in a nose job. So ideally, a primary rhinoplasty or nose job goes well the first time, and the patient will get the results they're looking for, and then we're done. However, um, because rhinoplasties are so challenging and difficult, it's also un- not unexpected that some patients, unfortunately, will have results that's probably not intended or less than ideal, and then we have to talk about revision rhinoplasty or redoing a nose job. And if a primary rhinoplasty is considered one of the more challenging procedures we do, well, a revision rhinoplasty will be that much more challenging and difficult. One of the reasons is that a rhinoplasty will cause scarring within your nose that obviously wasn't there before. And when you do a revision rhinoplasty, you're going to have to deal with that scarring, which can be fairly straightforward to deal with, or it could be pretty extensive, and that really challenges the procedure. And there's no tests we can do, no x-ray that we can do to say, oh, this nose has a lot of scarring from the prior surgery. So it's one challenging factor. The second major issue is that cartilage is key to any rhinoplasty, and even particular so revision rhinoplasty, because the cartilage support in the structure and the architecture is what helps us achieve the goal that the patient is looking for. But after a rhinoplasty, a revision rhinoplasty may encounter less than ideal amount of cartilage. And so if you don't have enough cartilage, where do you get that from? Well, you can either get it from your ears or from your own rib cartilage or from a cadaver rib cartilage. And so that's why revision rhinoplasties are so challenging. So if you're thinking about this because you had an unsatisfactory and satisfactory result from your first surgery, then when you see a surgeon, make sure that they have experience with rhinoplasties to begin with, and also ideally good experience with revision rhinoplasties. In addition to the cosmetic kind of goals you have, remember that the surgeon also has to maintain or improve your nasal function, and that's another reason why cartilage support is so important.